Last week I visited the treatment rooms in London and I was lucky enough to observe a full day's surgery with 2 patients and also meet some patients coming in for consultations and also for follow-ups. One of those patients that came in was Will. Now Will's story is unfortunately all too common. He went to a big name clinic in Turkey and he paid for 2,300 grafts. And this is the result. So 5 months ago, he sought repair with Dr. Vara. He was just popping by and Dr. Vara were kindly accommodated to see him. I can see the passion in Dr. Vara when it comes to meeting his previous patients. Firstly, the hairline's been brought down too low and it's too linear. We can see that he has just a row of hairs in a fairly straight line that are growing. If you look at the angles and directions of these hairs, they actually grow forward and downwards, which made styling really difficult. When you add to that the hair that grew in the corners, and we've got sections that just hasn't grown at all, is growing up and then offwards as well. So he's got hair growing in multiple directions, he's got poor yield, and he's got a low hairline. Now, if you look at Will's donor area, unfortunately, the area at the back of his scalp has been pretty aggressively harvested as well. When you take too many hairs from too smaller area, you create this convoluence of scarring. It can also damage the surrounding hairs. So it's not just the hairs that you remove, it's also the surrounding hairs. And you can see that if you look closely that the hair has changed caliber, it's softer, it's a lot finer, which means there has been some trauma caused to that area. The other plan was to remove the front line that was too low of his hairline. So all of those grafts have been punched out. So he had 226 punch outs. Now those hairs were redistributed further back into the hairline. He also had some hairs growing at an unnatural angle in his temporal point. Those have been punched out. They were also redistributed further back. In total, Will had 1,479 grafts, which includes the 226 punch outs that were redistributed. Those grafts were used to create a slightly higher, more receded hairline with lots more irregularity and to fill in the density in those areas where nothing really grew. Now, thankfully for Will, he's got a great head of hair behind his hairline. So, whilst he was living with this unnatural looking hairline, poor angles and directions, he was able to style his hair across to cover that area. So he's been able to hide it. But unfortunately, what happens for a lot of guys is that they have these surgeries into the hairline and they haven't got the hair behind it to cover, and they have to live with this unnatural looking hairline exposed. The other thing about Dr. Vara's approach is that he's really managed Will's donor area superbly well here in harvesting very conservatively from the sides of the scalp, not using huge number of grafts. He's recycled those existing grafts from the first surgery and replanted them back into the temporal areas and further back as well. Will's had an incredible come already. He's over the moon with his results. And remember, this is only 5 months. He's going to see a lot more improvement over the coming 7 months. If we look at the punch outs, we can see that on the temporal points, he's healed incredibly well. There's no signs of scarring. Now, with a 4K camera zoomed really in closely, you can just about make out some subtle scarring in his forehead from where the grafts were removed, but we fully expect that to improve over the coming months. I'll let Dr. Vara explain in more detail the surgical approach.
Good morning, it's Dr. Vara here. I've got my lovely patient Will. He is 5 months after his initial repair surgery with our clinic. What he had done in these pictures that you can see, he's had his surgery previously in Turkey where they've implanted hair in odd directions, odd angles, too low with really poor yield. What we did to repair it is we took out part of his hairline right the way across, relocated and recycled his hairs back into the temples and back into the hairline. We also had some complications in terms of his donor area. We wanted to fill in other areas of his temples. We couldn't use his normal occipital donor area for his hair transplant because some of those hairs had been really poorly traumatized from his previous surgery. So what we did is we took out hair from his left and his right parietal region, and that's how it's healed on his left. It's healed really, really well, almost undetectable areas of scarring in both donor zones. I'm going to go give you a comb through of that on that side, and then the same thing on Will's right side. Beautiful healing there. You will see on his back here, the hairs are slightly fine and they've really been traumatized from his previous surgery. So we didn't use any hairs from there. We only used the left and the right. Now he's healed incredibly well across his hairline from where we did punch outs. So you'll see subtle scarring across his hairline. That's still healing at 5 months after surgery. But again, really difficult to see that scarring in any way. And then the same thing on his left-hand side of his hairline, right the way across there. We also did some punch outs of his temporal angle here, and that's actually worked out incredibly well. We've taken out all those hairs. It's now looking very nice and natural. The hairs that we implanted, we transplanted over 1,400 grafts into his temples and his hairline. We had to contend with poor angles and poor direction that he had previously. So we've partially corrected those, and actually the growth of his hair to date has been so good, and it's going to improve those finer hairs, sort of softening its appearance of his hairline. And then the same thing on his left-hand side. His outcome is going to improve as the next few months roll on, and I expect him by August, September 2026 to have an even better looking outcome than he currently has right now. But it's needless to say, the change from before to now has been completely revolutionary for Will, and I'm so happy for him. And he's gone through such a traumatic event from his previous clinic. Actually, him trusting us for his repair was actually a huge bridge for him, and I'm so glad he has done, and I'm really looking forward to seeing him grow in the next few months.
So in summing up, at 5 months, I'm not looking for density at this point. I'm just looking for the healing of the punch outs. I'm looking at how the new grafts are all growing in the same direction. They're already starting to have a good influence on the existing grafts that remained into his temple corners, and that will only improve over the coming months. The hairline already looks so much more natural, and the remaining donor area is also being respected. And that's why I talk so much about natural hairline design and responsible donor management. The first surgery is the most important one. If that's done poorly, you're not building forward, you're repairing.